Fine. Welcome everyone for the ADC webinars once again. This is 158th online seminar today on 10th April, Sunday. Topic is PRP, Facial Aesthetics Perspective, to be presented by Dr. Stuti Bajaj. I take immense pleasure to welcome Dr. Stuti Bajaj, today's guest speaker. She is MDS in Oral Pathology. She has done MDS in Oral Pathology. She has done medical cosmetology course from Germany. She has completed her MBA in healthcare and hospital management. She has done a lot of social work and certified by Indian Council and Government of Haryana. And so many organizations have felicitated her, and so many people and guest speakers and all felicited her for her social work with so many NGOs. So we congratulate her for such a good cause, for the good work for the society. And we are happy that she is our speaker today, guest speaker. So welcome, Dr. Stuti Bajaj. The stage is yours. Thank you.
Thank you, sir. It was a pleasure being with you and everyone around. So shall we wait for another few minutes or shall I start?
3 people are there. Few people joined, they disconnected, I think. They will join back. 10 participants are there. So we can start. If more people will join, I will welcome everyone. You can start the presentation, no problem.
Okay, sir.
To listen.
Hi everyone, this is my short introduction. I hope it's visible.
Yeah.
I'm currently based at Ahmedabad and my clinic name is Face Hospital, as you all can see. And you can connect with me at WhatsApp, Instagram, Facebook. So basically, what is PRP? PRP is a viable and intact concentration of human platelets. It is found in our body itself. Basically, our body has 3 components: red blood cells, white blood cells, along with platelets and plasma. So in the PRP, generally we centrifuge and separate all these 3 portions. See, this is the differentiation. Like red blood cells being the heaviest one will settle down, and in between the plasma and red blood cells, we can see white blood cell and platelets, which would be white in color. The upper portion yellow is plasma, but that is mostly poor plasma. PRP is platelet rich plasma, which it is only less than 1%, and other is poor plasma. This is basically used for skin, as we are going for the facial aesthetics today. This company gives autologous growth factors into the tube, vial or the ampule, and into that we can withdraw blood. And then you can clearly see the white area between yellow and red area. This is the platelet rich plasma. So what are the properties of PRP first? It can act as a hemostatic agent, which generally is used in dentistry nowadays. And on the skin layer, it helps for the regeneration. Yes, sir? At the skin layer, at the skin level, it regenerates all the 3 layers like endothelial, epithelial, and the epidermal, which we basically deal with. What is the another property which is helping us in facial aesthetics is the angiogenesis, that is new blood formation, collagen induction and synthesis, which is the basic requirement for any rejuvenation. Third, healing. So healing part goes with the orthos, as they have knee issues and the PRP is a very successful treatment for them. Another property is it acts also as a hemostatic response to any injury. Now comes the preparation. It is very easy and it can be done at chair side. It does not require any special instrumentation for you. 2 things can be done if you are comfortable for withdrawing the blood, you can do it by yourself. Otherwise, you can call any laboratory guy or phlebotomist, and he can withdraw blood for you. Second, then we need to centrifuge it to separate all the layers. So that can be done in-house if you have centrifuge machine. Otherwise, the laboratory does that for you. And from that, we extract the plasma, platelet-rich plasma, PRP, with the help of insulin syringes, which is very thin and smaller in size, so patient does not have pain into it. And then we inject into the concerned area or the whole of the face when required. But before injecting, the numbing process is to be carried out. Otherwise, the microneedling or the derma rollers which you are going to use, or the direct injection technique, then it would be very painful to your patient. So he or she might not agree to the treatment next time. So better numb for 45 minutes, either with the Prilox or different companies are available. And the numbing spray, 10% lignocaine is also very successful in it. And then you can inject it. So how does the PRP helps in healing? First, the matrix formation occurs. And as I said, angiogenesis, new blood formation there occurs at that localized area where you have treated with the PRP injections. And then the collagenation takes place. So newer collagen fibers are being formed into it. And then the cell proliferates. And this is how the skin layers or the new cells are being regenerated. And the skin feels younger and much better. So where you can use your own blood, basically it is used for the scars and the wrinkles. So why PRP is in booming right now? Because it gives you a beautiful skin. Everyone dreams of it. And when you have a beautiful skin and you build up a confidence into you, so you can do your task easily, and your attire, your appearance, that matters in today's world. So looking gorgeous is everyone's dream, and PRP being safe and it's your own blood, so it will fulfill your dream. Then it is basically for to get flawless skin, beautiful skin. When it is also one kind of anti-aging treatment, so that will help your skin to rejuvenate, to look younger, brighter, whiter, and all those treatments can be done with it. Basically it helps to give you a natural looking effect. See other treatments, just say BB glow, if you have heard about, those are semi-permanent makeup kind of thing, and it involves the chemicals or the materials outside of your body. But PRP being your own blood, it gives you a natural looking treatment, and no one notices because it has no downtime or minimal downtime. So with the consecutive treatments or the sessions, the people around you can notice your skin changes, and it is most trusted treatment and safest with no side effects. So what is the procedure basically? We can withdraw between 5 to 15 ml of client's or patient blood and then centrifuge. There are 2 to 3 options. One is you can directly do without the growth factors if the patient is not willing for that. So you just need to extract patient's blood, centrifuge in the ACD tubes, or you can use sodium citrate for the dilution into the blood, and you can centrifuge in your own setup, or you can talk to the laboratory person. Other, like in the initial slide I showed you, Uskin is one of the companies who provide you the vials or the ampoules along with the growth factors, which enhances the result into it. Third, you can use PRP along with the derma rollers or the derma pens, which is known as micro needling, or you can induce directly into the skin. So vampire facial is another name for it when we are doing micro needling, as multiple pricks have been made on the patient's face. So that gives a vampire look. Is one of the treatment that rejuvenates our dull and tired skin, and it is injected and it increases the stimulation of the cells. So cell proliferation, it goes very rapidly, and that gives you a healthy skin. Because being a pathologist, as I can explain you, at the basal layer, these cells are being formed, and then at the top layer, they get exfoliated or they shed off. So during that mid stage, if we inject platelet rich plasma, that will help the cells to stimulate or to convert or into a larger number. And then the skin which is being formed after the shedding of the cell would be a newer, glowing, healthy skin. So how does it rejuvenate? Because the body cells which you have in your body, that helps the tissue in healing and producing new cells. PRP is basically targeted into the particular areas of the skin. So that helps in growing of your collagen of that particular region, because as we are targeting into the face, the collagen portion of your face would increase n number of times, and that would give strengthening, tightening to your skin because of collagen, and that would be a smooth and glowy surface. Then another reason, PRP would soften the wrinkles, and the skin texture would be smoother, and the tone of your skin would be younger and better. So the patients who are not willing for the thread lift, or they want skin tightening but with minimal treatment, PRP is the key. Another reason you can use PRPs are for the eye bags and the dark circles apart from fillers. Because filler is a temporary treatment and it lasts for between 6 to 18 months only, and patient need to come back to you again and again. But with the plasma, this PRP treatment, he needs to visit you depending on his condition and the look he desired. 3 to 4 sittings would be good enough to have a tired free look. So our baggy eyes and disappointment loses their confidence. So this will all can be improved with the PRP, which is a simpler process. You can also definitely add on along with the PRP's different treatment like under eye peels or lasers if your patient is willing for the another treatments even. See, in this you can see the tightening, wrinkle-free skin, and the pigmentation, sagging, all is covered with only PRP. No other treatment was used. Now, what is the good effect with the PRPs? It enhances your skin elasticity, tone, and thickness even. How does it help in it? Because of stem cells. They differentiate and proliferate into different levels. As I said, in the epidermis, we have 3 to 4 layers. So at all different levels, the stem cells proliferate into the different cell types, and then they give you the result. Then PRP, as I said, angiogenesis trigger करता है. So blood vessels new form हो रहे हैं आपके, तो blood supply ज़्यादा रहेगा, तो आपको जो result चाहिए आपके skin पर वो immediately दिखेगा. फिर apart from fillers, PRP also gives a volumizing effect. If someone is doing fillers, they might know कि chin augmentation है, cheek augmentation है, we generally use fillers. So, but if the client or the patient is not willing for such a kind of treatment, you can always tell them for the easier option, which is PRP. It revitalizes. It can also be used as a regular medifacial. Those people who are going to the salons or the parlors regularly for their facials or cleanup, you can alternately tell them that the PRP is basically a vampire facial or the medical facial, which revitalizes, rejuvenates, and give a glowing look or the younger look to your skin. So you can have those kind of patients even. And while going through a dental treatment, you can pitch your patients for this medical facial even. And this does not require much armamentarium into your clinic, because syringe and the local anesthetic agents we have in our clinic. And it also treats fine lines and wrinkles. Those who have wrinkles and fine lines on the forehead and those do not want to go for the Botox treatment, PRP is the alternate option. Advantages you can explain, like it is minimally invasive or non-invasive. Sometimes minor bruises can be seen, but that is perfectly fine because after the ice application, it would be minimized. No risk of allergic reaction as it's natural patient's own blood, so no cross reaction or no allergic reaction chances. and it is can be used at any body area without any side effects apart from face even. And good for patients those who are not ready for thread lift, and the results are always long lasting. Contraindications, uh, those who are suffering from the platelet disease like coagulopathy, platelet dysfunction, hemodynamic instability, hypovolemia, sepsis, unstable angina, anticoagulants, antifibrinolytic therapy, you should first clear that and then go for the treatment, otherwise skip it, because if any of these are contraindicated in the patients and if you do it, there would be much difficulty, and the treatment would not be that much successful, and patient can have numerous side effects, but otherwise treatment has no side effects. Precautions what you can take on a chair side is, if you see minor bruises or burns, then icing is the safest and the easiest option, which because we have it in our clinics. And sometimes irritation or swelling can be seen post treatment, because as you have punctured many number of times onto the skin, so some sort of swelling can be seen, but it would be temporary and it would be relieved within few minutes or few hours. And icing helps at that time, because sometimes we get call after the treatment, patient goes home and after hour or two some kind of swelling or soreness patient feels. So you can counsel them in such a way that icing helps, or the application of water on their face would calm them down. And it's not an emergency procedure, so they do not need any uh, leave from their offices or hamper their work profile. And first and foremost is you should definitely take a skin test of your patient and ask them whether they have any sensitive skin issues earlier on any procedures they have taken. So you can decide the side effects, or you can counsel the patient accordingly, or you can do the treatment, whether you want to go for the micro needling, derma roller, or directly the injection therapy, you can decide. Another thing is that microneedling procedure somewhat inflicts swelling, and if patient is not taking proper care, then might end up into the infection also. If they keep on touching their face continuously after the microneedling procedure, they might contract some sort of infection. But then that can be controlled either by the antibiotics or the local application of the creams onto the face. But you should always tell your patient to never touch your face constantly after the procedure, or icing is the best option to avoid all this. And if some patient have already cut or bruises on their face, you should not inject into that part. And in between the treatments, you should give break, so that the patient's own body have self-healing capacity, and then it would be healed time to time if you give breaks in between. Lastly, if patient is taking any other pills or drugs without prescription or without your notice, that should be at least delayed, or into the concerned doctor consent should be taken before using it. And if the patient wants to continue that according to his or her concerned doctor, then he can be taken. But if he changes the drug, or in between he stops or does so, you should be aware of it, because that can hamper your treatment and your result even. And on the same day, or for a 1 day or 2 day, you should tell your clients or patient to avoid any hard heavy work, hard work, or very perspiring work, या फिर बहुत ज्यादा स्वेटिंग वर्क नहीं करना है, या फिर जैसे लेडीज हैं तो बहुत ज्यादा उनको एग्रेसिव वर्क नहीं करना है, जिससे क्या होगा, उनको कोई प्रॉब्लम नहीं होगी, बट बिकॉज ऑफ पीआरपी ट्रीटमेंट एंड द माइक्रो नीडलिंग, some pricks you have given, bruises are there, so that might give them pain, or they might feel some uneasiness. Now, who can be the best candidate? First and the most common is acne scars. Those who have acne scars are the best candidate for the PRP along with the microneedling. Another one is hyperpigmentation. Melasma patients also very much are common in nowadays practice. So that would be one of the best option for the safest and the easiest option for the hyperpigmentation patients. Fine lines, wrinkles, those who want to get tighter, firmer skin, uneven skin tone. For regular facials and cleanup, as I said, you can use it. For those who have dry skin, can also be added as a meso solutions can be added along with the PRP solutions. And that looks, if you're someone says in my 35 mid 40s I'm looking like older, like 60 years, so you should always suggest them this kind of treatment. This was done for the under eyes. In the above picture you can see the dark under eyes, and in the lower the bagginess and the dark eyes were reduced a little bit. So now we can take the queries.
Okay, fine. Can we all have, we can have cameras on, and one by one you can ask the questions. So we all can interact with guest speakers, and we can do a discussion also today. Any one of you already practicing facial aesthetics or PRP or any treatment you have done? Just like I practice in my clinic, PRP for hair as well as facial aesthetics. More of hair we do, but as we today saw the presentation, there are so many applications in facial aesthetics. So any one of you is practicing PRP or facial aesthetics in your practice?
No.
Okay. Any one of you has any question or query?
No, it's okay.
Fine.
Thank you, Dr. Sudhir. You have organized a wonderful webinar, and we congratulate you also for your efforts, continuous efforts from so long. It was good to see you after so long.
Yeah. Good to see you, sir.
Yeah.
So we will post a certificate to today's guest speaker on Instagram and Facebook page, and we will send you on WhatsApp also, Dr. Stuti. Thank you so much for a wonderful presentation. In my practice, I do, you mentioned about acne scars, then medical facial, you said, like hydrofacial we do. So instead of hydrofacial or along with hydrofacial, we do PRP.
Yes, sir. Definitely, it would give wonder results, because hydrofacial does not treat for the acne scars.
Yeah.
It is just for the glowingness or the blackheads, whitehead removals or the sebum removal. That's it.
Yeah. Okay.
But for the correction of scars, you need micro needling procedure or the lasers. So everyone cannot go for the lasers, and those are not ideal always for the lasers even. So PRP is a very safe, no downtime, and easiest option to repair scar.
Yeah, best part is there is no side effect of PRP.
Yes, sir. And even there is no downtime. Like if the client or patient is walking to your clinic, immediately he and she can resume his or her work.
Yeah, got it. That is also true. And depigmentation can be done. You mentioned hyperpigmentation in your.
So depigmentation alone with PRP won't get very much good results, but you need to club 2 to 3 options along with it, like peels or the lasers.
Okay.
Then it can help.
Came like post psoriasis treatment. There is a lot of hyperpigmentation or depigmentation, right? Darkening of skin, yes, as well as face. So that can be treated with PRP.
Yes, sir. It would be good if you use derma pen rather than derma roller. Derma pen along with PRP would give very good results for the hyperpigmentation patients.
Fine. They asked me for ozone therapy along with that, so that's why.
Yeah, and that is the great. And for the face, sir, the needles you should use for the micro needling would be 24 gauge.
Okay. Hello, Dr. Bhaskar. Thank you.
Okay. Thank you. Thank you very much, Dr. Sudhir.
Okay. Okay. Thank you so much for a wonderful presentation, Dr. Stuti. We wish you all the best, and we wish you keep continuing presenting such webinars and your courses. You have any course in your practice, like any hands-on course or anything you follow in your practice?
Yes, sir. I teach my subordinates and juniors, and some of the beauticians have approached me for it. So I have started recently teaching them the peels, PRPs, BB glow, which are very much currently into the scenario. So I have started with those. So if anyone wants to connect with me for further updates regarding it, can connect to me.
Fine. Great. Thank you. Thank you so much once again for a wonderful presentation. So see you.
Pleasure is all mine, sir.
Yeah. Wish you all a very happy Sunday. I'm ending the meeting. Thank you so much.
Thank you, sir.